A gastrointestinal illness is making hundreds of people sick across several states, including 48 cases here in Texas. Health officials are investigating a growing outbreak of cyclosporiasis.
The parasite is often linked to contaminated fresh fruits and vegetables. While the source of this outbreak has not been identified just yet, doctors say it's important to know the symptoms and when to seek medical care. So joining us now to talk more about this is Dr. Theoktisto, an infectious disease physician at Baylor Scott White. Doctor, welcome and thanks for joining us today.
Thank you for having me.
So I think a lot of people have probably seen headlines about this, so it's good to clear up some information about it. So talk to us about what cyclosporiasis is and how someone becomes infected by that.
So cyclosporiasis is caused by a microscopic parasite called cyclospora, meaning you can't see it with your own eyes. You have to see it through a microscope. So usual way of transmission is some sort of contaminated food, vegetable, or water, and it's contaminated with human feces.
Not something you want to get or have on, as we mentioned, fruits, vegetables, things like that. So what symptoms should people be on the lookout for, and maybe navigate for us, how is it different from a typical stomach bug or maybe a food poisoning that people are familiar with?
Right. So it typically causes a frequent watery diarrhea with abdominal cramping, gas, and bloating. What makes it a little different is the severity of the symptoms, and you can get prolonged symptoms as well as relapse symptoms. So sometimes the symptoms will last a few days, but it can be prolonged up to months in some people.
And we've mentioned a few times in our shows while covering this is that the source of this outbreak is not known exactly just yet, but since fresh produce may be involved with this, should people be avoiding certain foods right now? What would be your advice?
Since we don't know the actual source, fresh fruits and vegetables are still an important part of our diet. How to prevent this infection would be washing your vegetables thoroughly, making sure you're cleaning the surface of uncut fruits. Hand hygiene is very important, washing your hands with soap and water, and then cleaning surfaces where you're preparing foods as well.
Okay, if unfortunately someone does come down with this, how is it treated? Does it resolve on its own, or is there medication to help folks through what sound like some pretty unsavory symptoms?
Some people, this will self-resolve after a few days, but those with prolonged symptoms should seek care from their healthcare providers. There are treatment options.
And doctor, is there anything about these cases popping up, not just in Texas, but other states, that's concerning to you or that you would want people to be aware of right now?
We tend to see some of these more gastroenteritis illnesses in the summer months. So it's just something for people to be aware of and just to kind of remember, again, basic hand hygiene. It can affect certain populations more severely. So that would be young children, pregnant women, elderly, and then people with weakened immune systems as well.
Are there any complications that those more at-risk populations should be on the lookout for if they are to be diagnosed with this?
It's really the prolonged symptoms. So if you're having a diarrheal illness that's lasting over a week or two, it's probably something unusual. People with weakened immune systems can also recover and then have a relapse with a recurrence of symptoms.
Well, that is Dr. Theoktisto with Baylor Scott White Health joining us here to talk about cyclosporiasis and the prevalence of that right now. But doctor, thank you again for joining us and for taking the time to talk more about this.
Thank you.